Hello, this is Shanelle Van Dyke with Quality Reporting Services, and I'm going to give just a really quick tutorial on the differences between OP27 and IMM2. Lately we've gotten a few inquiries here and there from Wyoming Critical Access Hospitals on the difference between the two. There's been some confusion in thinking that they are just one measure, and indeed they are separate measures. So today's brief presentation is just going to be on the differences of each of those measures. So quickly, the agenda, I'm going to go over the difference between the two as far as their measure definitions, which reporting system they belong to, how it's collected and reported, as well as their deadlines for submission. And if there is time, I'm going to briefly bring up resources for each. So just real quickly, on the screen now there is a snapshot of the MBQIP core measures. And on the left-hand side of the screen, I'm just going to be touching on the patient safety component, which consists of the two measures, the OP27 and the immunization 2. So here's just a side-by-side comparison. The IMM2 is influenza immunization. It is under the Inpatient Quality Reporting Program. It's collected and abstracted into the CART application, and then it's uploaded to the QualityNet website for submission to CMS for the purpose of MBQIP Flex requirements. It is collected and reported quarterly, whereas the OP27 is the influenza vaccination coverage among healthcare personnel. It's categorized as an outpatient quality reporting measure, and it is collected and submitted within the NHSN website. And that's typically done by the infection control or infection preventionist staff member at your facility. And this measure is actually collected and reported only annually. And just bouncing back here real fast, like to the IMM2 influenza immunization measure that's collected and reported quarterly, that's typically done by whomever at your facility is collecting and reporting your core measures, whether it's your QI director or a member of your medical records or so on. So here's a little bit on immunization 2. It's a performance measure. Its definition is influenza immunization. I gave the measure ID, which is IMM2. The measure set is considered to be an abstraction measure, and then I just gave a brief description. This measure is a prevention measure that addresses acute care hospitalized inpatients aged 6 months and older who were screened for seasonal influenza immunization status and were vaccinated prior to discharge if indicated. And again, it's a quarterly submission measure. The OP27 is also a performance measure. It's the influenza vaccination coverage among healthcare personnel. The measure ID is OP27, and the measure set is considered to be web-based. So unlike the IMM2 where you're actually abstracting the data out of the chart and entering it into CART, with this OP27, it's actually your infection preventionist or infection control nurse that's logging into the NHSN website and actually just entering the numerator and denominator in the system. The description, I actually just put in the link for the CDC website on that specific measure, as it is the description they give, the rationale, the numerator and denominator statement and everything. I believe it's like a 4 to 6 page document. And again, this is an annual data submission measure. And then I gave a little bit more specific information. There is information out on the QualityNet website as well, and I gave instructions on how to locate that. At the end of the presentation, I'm going to try and share my desktop and browse out to QualityNet and show you where to gather information on both measures. So side-by-side comparison of the data submission deadline. On the left-hand side of the screen, you will see the inpatient immunization measure. The next upcoming deadline is May 15th, and it is for fourth quarter 2016 discharges, which is October through December. And then over on the right-hand side of the screen, you have the outpatient OP27, which again is annual. So you'll see that open up the submission anytime between October 2016 to May 15th, 2017. And the data submission time period that they're looking for is, again, that October through March. And then similar, you have the next data submission deadline, which is annually. They open again up in October 2017, and it goes all the way through May 15th, 2018. And the time period that they're looking for is October 2017 through March 2018. So see, you have an annual submission and the next two time periods and deadlines for outpatient OP27. And then on the right-hand side of the screen, you will see the next three data submission deadlines for immunization 2, along with the time periods that they're looking for. So I just wanted to kind of give a visual of how it's all collected. Here, we're just going to focus on the red circle where it shows the CMS inpatient measure for IMM2 is submitted via CART. For pretty much all Wyoming critical access hospitals, you use the CART application, so ignore that comment about the vendor tool. For larger acute care hospitals and even some large critical access hospitals, they pay a third-party vendor to actually assist them with the abstraction and reporting. But for you, you would collect and report it in CART and then submit it to QNet, and that's how it gets to the feds. Then, just to give you a visual of the CART, this is a couple screenshots of the CART application that's housed on your computer that you bring up and you start doing the data entry and collection into. So this is where you would actually enter and collect your immunization 2 data. And then as far as submission, a couple screenshots here of QualityNet and logging into QualityNet. This is where you would actually upload and submit your immunization 2 data quarterly. For the OP27, the outpatient healthcare personnel vaccination measure, we're going to focus just on the red circle here. That is all collected and entered into NHSN, and then it goes from NHSN to the feds. Here's a little visual. This is a couple screenshots of the CDC website of where your infection control or infection preventionist would log in to submit all of the healthcare or hospital-associated infection measures, which includes OP27. Some helpful resources, I just included some links. We have a link for CART Basics, as well as how to abstract and set up patients in CART. I gave some links for both the outpatient and inpatient specification manual, along with a little bit of instructions. And then below I gave some helpful links for NHSN, such as NHSN training, as well as a specific link that is all about, again, all that information on that healthcare personnel vaccination OP27 measure. And I'm just going to leave this screen up for a second. Here are contacts for you to reach out to. Kyle Cameron is the new Wyoming Flex coordinator. So anything Flex related with questions, reach out to her. Both myself and Rochelle are here to help you with MBQIP. So any inpatient, outpatient, ED transfer, abstraction and reporting questions, anything related to MBQIP, please reach out to us. I'm going to exit my full screen view and share my desktop. Okay, so you should be seeing my desktop. I'm going to bring up the internet. I'm going to bring up a new tab. And I'm going to go out to the QualityNet website, which is www.qualitynet.org. And I apologize for the font being small. I just wanted you to be able to see a lot of the options I'm going to show you. So for the IMM2 measure, I'm going to hover over hospital inpatient, and I'm going to scroll all the way down to specifications manual. And the website's a little slow today because of the extended inpatient data submission deadline today. So here I have a table. It's going to say what time period are you looking for, and then it's going to give the version number. So for the purposes of the next upcoming deadline, which is for fourth quarter, I'm going to look at the second option, which is 7/1 to 12/31/2016, version 5.1. I'm going to click on that link. It's going to bring up everything for that version of the specs manual. I'm going to scroll down, and under here in the section 2 for measure information, you will see right here immunization. I'm going to click on that. I'm going to hit open. It's going to bring it up in a PDF document. And here is an 11-page document about everything you need to know about the IMM2 influenza immunization measure. All the data elements that it's going to ask you in CART, from the sample size requirement, the population. Scrolling down, it gives you the description. Some of the stuff obviously included in the PowerPoint presentation. And then it's going to give you a breakdown of the numerated statement, what's included, the denominator statement, what's included, excluded, you name it. You just scroll down, and here's just all the information, even resources or references, I should say, about this measure. And then for those of you who like algorithms, here is a step-by-step instruction of algorithms from abstracting the chart. How to identify it, how to go through yes or no on answering the questions in CART, and so on. And then it gives you a narrative to go along with the algorithm. So I'm going to close out of this. And I'm going to scroll back up to the top, and this time I'm going to hover over hospital outpatient. I'm going to scroll down to specifications manual. And again, it's going to bring up a time period table. So again, for the next deadline, which is fourth quarter, or in this case, the annual submission, I'm just going to select 7/1/16 to 12/31/16 again, which is version 9.1 for outpatient. I'm going to click on that link. And it's going to probably give me a security warning to accept the terms and agreement. Yep. I'll scroll down and hit accept. Similar to inpatient, it's going to bring me to a breakdown of the manual. I'm going to go to section 1 for measure information. And here you'll see all the measures within outpatient. So if you want information on the additional outpatient measures, everything's going to be here. I'm going to scroll down to the bottom where it says web-based measures. And here you'll see OP27. I'm going to click on it. I'm going to hit open. And here is the document. Well, it's just a one page, but here's the document on the influenza vaccination coverage. Again, there's not much to see, but it does say look for more resources on NHSN, and the reason for that is because it is an HAI measure that's collected and reported to the CDC. So if I click here, it will take me to the NHSN website. And here is where you can actually find the specific information on OP27, which if I scroll down, I believe it's part of the healthcare personnel safety component. When I open that up, here's going to be the whole manual on all the measures. And here you will see in the table of contents and whatnot, it's actually broken down. But there are additional documents out there like an OP27 summary and so on, which actually I thought I had saved on my computer, but you get the gist on where to find the resources and the difference between the two. That was the purpose of this little quick tutorial. But I think if I actually do OP27 up here and hit search, it should bring up the resources. Yeah, here you go. Here's all the resources on the influenza vaccination coverage. So I'll just click on it. And here's a plethora of information. So again, this is for those of you who just do all the abstraction reporting for core measures within CART or the ED transfer tool. This is going to make the most sense to your infection control nurse or your infection preventionist. So again, I don't want to dive into too much because I know when it comes to the OP27 measure, just simply meet with your infection control, infection preventionist and say, hey, is this a measure that you're collecting and reporting on a regular basis? If they say yes, there's nothing more you need to worry about in terms of MBQIP Flex requirements. So just confirm with them, your infection control person, that they are collecting and reporting this information, and that's all you need to worry about. In terms of the IMM2, that is something that falls on you for abstraction and reporting quarterly within the CART application. So that's it. If you have additional questions, please reach out to me, whether it's related to IMM2 or OP27. I'm happy to answer any questions you have at all. My email address is up on the screen. And thank you for your time.